Hello and welcome again to Upgrade Dental's Second Opinion. I'm your host, Dr. Brian Laskin, and I'm very excited to have complete rock star from a great company. Not just a great company, not just a great innovative company in dentistry, but a great innovative company in Minnesota in dentistry. So we have Kay Hickey with us from Zirc. Thank you for being here very much, Kay.
You're welcome. I'm glad to be here.
Well, I'll introduce you a little bit and then we can get right into it and all the great things that Zirc brings to our loved field of dentistry. But Kay is an amazing team member over at Zirc who has over 30 years of experience in the dental industry as a former dental assistant and dental educator. Currently, Kay is an efficiency consultant with Zirc Dental Products, where she helps dental clinicians organize the chaos to create a happy, safe, and efficient environment. And anybody who knows me, anybody who does anything with Upgrade knows that we are completely aligned in having efficiency, safety, and happiness as core to dentistry. So thanks for being here, Kay.
Yeah, absolutely. I think it's kind of a buzzword right now. We're hearing so much about the burnout and the stress and what clinicians are feeling on a day-to-day basis. I'm seeing more and more podcasts and articles and things on this subject. So I think it's well timed. Absolutely.
Do you think it's the pandemic that has kind of like, I don't want to say push people over the edge, but push people over the edge? I mean, because there's always been burnout in dentistry, but I agree with you. It seems to be a lot more stress going on in dentistry.
I'm hoping that might be getting a little better, but part of that stress is just because so many are working short-staffed right now. That's going to be adding to their stress because it makes it harder to get through their day. But like you said, Dr. Laskin, for as long as I can remember as a young dental assistant, hearing about, dentistry has the number one cause for suicide amongst professionals. And so I think it's always been kind of on the radar that dentistry can be stressful, can be chaotic, and can cause burnout. So it's good to be talking about this. And it makes me feel really excited that we do have some solutions. There's all sorts of solutions out there, whether it's software or technology, or what we do is create more efficient clinics to save time and money in your day.
Yeah, and I love talking about products like yours because I think most people think of technology as like the kind of stuff, software as a service, virtual reality, like I'm involved with, or robotics, or AI, or a website. But at one point in time, a pen was an innovative piece of technology, right? And there's sort of, I think, unsung heroes of the technology space, like the products that you have at Zirc that really can change practices. So could you talk a little bit about what you do just down the road from me in Minnesota?
Yeah, this is pretty convenient. It's too bad we can't be in person since we're maybe 40 minutes apart.
I could have had you sitting here right here. Yeah, we should have done that. But, oh well, next time.
So Zirc, we're going to focus, I think, a little bit more on our color code system that we have that we call the color method, which just utilizes our organizational products for managing instruments, materials, all of your excess inventory, to make you have a real streamlined system from room setup to reprocessing and back again. So that's a big part of what my job is here at Zirc is to educate dental offices on how we implement something that's going to really save them time and money and help them be more efficient and happy, like we were talking about. But we have other lines of products for efficiency too. And we've got probably the biggest line of isolation devices in the industry. We've got Mr. Thirsty, which is a hands-free, high-volume device that actually has a bite block in it. It's very much like Isolate or ISO Shield or one of those. Ours is 100% disposable, and there's no, units needed. So that's been really big for us. And our InstaDams come pre-punched and pre-framed. We just take a product that's already there and make it better. Dams have been around forever. But we know how it is. You put half the rubber dam on the frame and then you go to put the other half on and then it falls off. So, we just do little things like that. So we've got lots of isolation devices that can help you work more efficiently as well.
Well, and I've got to say, as you mentioned Instadam, I think I used the very first month I ordered Instadams when it came out. And I was around when they came out because I've got some gray in my beard. But I don't think of another product that got rid of something that I hated to do as much in dentistry as the Instadam. It's just one of those products, like you said, it just makes the worst part of placing a rubber dam just completely go away. I mean, for me, it was a transformative product. I think it's just, I could talk this whole podcast, this whole webinar just about Instadam because I love it so much.
Well, and we used rubber dam all the time when I was in the clinic, and it was a two-person job. To be able to put that thing on efficiently, you really needed to have two people. And we did a time study here at Zirc where we placed the dam. We had other clinicians, and we had just one patient for all three different clinicians that we had. And we had them place it 3 different times with the standard rubber dam and the Instadam. And we found that we're about 50% faster in being able to get that thing on.
It would have been about 90% faster in my hands. I don't know what it was. It's like in dental school, it's just one of the things that I was horrible at was like the little U framed. Oh my gosh. It's like bring back nightmares from dental school. I haven't used a traditional rubber dam in probably 15 years when the Instadam came out, right?
That's cool.
But yeah, great product. I want to talk a little bit about your color coded system because I know that, or I should ask you because you're going into practices all of the time. What are the biggest opportunities for improvements in the average dental practice? If you were just to go down the street, go in a practice that you've never talked to before, what would you say? Well, they're probably doing these 3 things that they benefit from changing.
It's a really good question. And number one, because we do go into practices all the time and we get down there, we're looking in their cabinets and going through their treatment rooms and sterilization centers. And we could do television series on dental hoarders, because if you've been in practice and it's not a brand new build and you've been in a practice or bought a practice, you're inheriting somebody else's mess. And we will go in and fill boxes and boxes and boxes of junk. So expired materials is a huge one. Tell you a quick little story. I had a practice that I went into to help them get organized. And I started in the sterilization center and I opened up a cabinet. There was this big basket and it was full of a variety of different impression materials in the cartridges, along with some tips that were all mixed up in there and everything else. So I started going through that to try to get some organization to it and realized that over half of it had been expired. So I counted it. I threw away 14 cartridges of impression material. And Dr. Laskin, you probably can put the dollar amount on that. I couldn't at the time, but I came back to the office and kind of looked it up. I bet I threw away over $800 in material in less than 10 minutes of me being there. So that's a huge thing, that a color method where we have really good systems, really good operating processes in place, it's going to eliminate that. As a dental assistant myself, back before I knew Zirc, every time the doctor would leave town, I would go through the drawers and the cabinets and try to get everything reorganized, fresh and ready for the doctor when he came back. And it's like, oh, I've got 5, A1 composite flowables opened in my drawer, and I've been always running to grab another one because I couldn't find it. But that's what happens when we're using a drawer system. Things get buried, disheveled, small things get pushed to the back. We're in a hurry. We're disinfecting and throwing them back in there, and we're not keeping track of it the way that we could if we had like a tub system, which is what we teach. So, the expired materials is huge. The other thing I would look at is how are they managing their instruments? I don't care what kind of cassette you're using, but to me, that's a must. If you want to be able to work efficiently and never have a lost or missing instrument in your setup, you're going to be safer. You're not having to handle all those sharp, dirty instruments for reprocessing. You're going to keep those instruments all locked in that cassette all the way through your procedure, through the ultrasonic cleaner, through the sterilizer. I used to stay after work for 30 to 45 minutes sometimes, just finishing doing the reprocessing and cleaning up. When we finally transferred to cassettes, and we used stainless steel, we didn't use their cassettes then, and they worked great. Cassettes in general, I don't care what brand, is the key, because I wasn't having to stay, maybe 10, 15 minutes after, but it was a big deal. And doctors, not only is your staff getting out on time, which makes them happy, you're not having to pay overtime. There's a big budget killer as well. If you're paying time and a half because they're having to stay late every night or work through the lunch every day. So, cassettes, expired materials are the 2 big ones. And I think just that level of stress and team camaraderie and patient perception, that all kind of runs together too. If we're all running around like crazy people and we're not spending the time with our patients that they deserve, patients aren't having a good experience. We're not explaining the value of the treatment that we're recommending, they might not even understand why they're coming back to have that crown. Not only that, are they going to schedule the appointment if they don't understand it? Think doctors, what is your unscheduled treatment that you have in your practice? Practice management consultants will come and show you tricks and, tips on how to get that down, things to say, good verbiage. But I'm sorry, us in the clinic can blow that for you if we're not doing our part of the job. So
I agree with everything you said. I mean, having tubs and cassettes and systematizing your practice. I mean, as you and I have talked about, I created the entire Insanely Productive Dentist series because I feel like practices need to systematize their practice to be massively productive. When in a time when profits are being squeezed, I think it's going to be more important than ever before for practices to really focus on organizing, systematizing their practice for the reason that you stated. And I think you kind of went over, the tubs and systems, but the colorization of it, like the color-coded system simplifies it so greatly that, and I think that it's almost so simple that people don't understand the power in the simplicity, right? I think that is absolutely key because people they only do what is easy to follow and easy to do, flat out. That's the way it is. Look at the way that dentists do bonding, right? If you open up a bonding kit, what's the very first thing you see? It's pictograms showing you how to use this thing, because that chemist that spent 20 years perfecting that chemistry knows you're not going to read the instructions, right? So they have these color-coded diagrams to follow. And if you think that your assistant is really going to dig in and think out, like, no, let's make it easy for everybody.
I don't have time for that, right?
What's that?
I said, I don't have time to read the instructions. Absolutely.
No. And by the way, the dentist doesn't want to give the team members time to read the instructions. It's like, just pick it up and go. And I kind of feel like that's what Zirc brings, is this like simplicity, this sort of pick it up and go, as easy as 1, 2, 3, which I think oftentimes is overlooked because of how simple it is, but that's a big part of its power. Do you agree?
Absolutely. Everything you said, by doing procedures identified by a certain color is going to be key. So that's the first thing I always tell offices to do is, write down your procedures and then assign each procedure a different color. And especially, I don't mean to bring up the short-staffed negativity again, but especially right now, any time it's going to be, perfect to have it that way. But if you've got your front office person that's trying to step in and help the assistant group do room turnover, all they have to look is the color chart in the sterilization center or wherever you have it, and they're going to know I'm going to grab a blue tub, a blue tray, and that's everything they're going to need for that composite or whatever procedure that happens to be. Training new team members. That's, as an assistant myself, I had pretty good confidence in my clinical skills and I could make a temporary crown and the whole thing. But what would make me the most nervous is I don't know where anything is and I don't know what the doctor uses. And I keep having to interrupt people to show me this and to show me that. This is going to take that guesswork out of it.
One of the things I talk about in Insanely Productive Dentist is setting your team up so that if somebody's sick or gone or you're short staffed, like you talked about, which I think we have to talk about it because it's a big deal in dentistry right now.
Yeah.
But your office, I believe, should be systematized so that you can bring in an assistant, a new hygienist, and they can probably perform at least 85% as well as your existing team member, right? And this gets you a long way there, right? If you bring in I know a lot of dentists that won't hire a temp assistant because, I just can't work with them. No,
yes,
they can't work with you, right? Because you haven't set them up for success.
Right.
That's how I look at it.
Oh my gosh, that is so spot on. It's a really good point. I love that.
Yeah, so let's, one of the things that I also want to talk about, because this is second opinion. So I want to ask the questions that dental teams might be thinking. Like, the big thing that comes to mind is I'm already short, we're already short staffed, we're super busy. How do we go about bringing in a system? I kind of have to slow down to speed up. So how do we actually do this in a way that's not we don't have to shut down for 3 days and incorporate things. So if someone's listening today and they're thinking, I really should organize my cassettes and tubs and bring in, better isolation into the practice. How can they do that without just kind of turning the apple cart over?
That is the difficult part of it. It is really hard. It's not a difficult system to implement, but it is a little bit time consuming because you do have to go through all of your materials and instruments and make sure that everything is uniform and everything is complete. And then it's simple just to get them into the tubs and the cassettes. As an efficiency consultant, I can help you with that. So we can send you out. We have a product that we call Zobi. It's actually a box full of all of our organizational products, instrument cassettes, burr holders, tubs, and trays, and so forth, to give you a hands-on experience to help you determine what you might need. We are just starting a new line of services, and I don't have that in front of me right now, but we're going to do 3 different tiers. We haven't launched it quite yet, but one of them is called Reset. And what that is we get a lead contact that gets us all the information we need. We get pictures from them so we can build the tubs here at Zirc for them. We fly out or drive wherever, and we have 2 team members that'll come out and work with the dental team. You'll have to close down for 1 day. We've done it where we've had half the staff working and half the staff implementing. It doesn't work very well. It's like, to get it done in 1 day, we are busting our hump. And so I would really encourage you take 1 day, or we could come in on a Saturday if you've got a team that's willing to come in and do a little extra during the week and get that done for you in 1 day. That way it's done correctly. We train the entire team, and in 1 day, you've got it. So Monday morning when you wake up, everybody's been trained, you've got the system in place. Yes, is there a learning curve? It'll feel a little weird at first, grabbing a tub and a tray from sterilization and going into the room. But that's going to become second nature probably after the first day or 2 of using the system like that.
Well, I love the idea because I know, one of the things we look at Upgrade is the value over time, right? And I want to talk about that right now because we're talking about shutting an office down for a day, and it sounds like a lot because let's call it 8 hours.
Yep.
But on the back end of that, can you talk a little bit about the time savings? Because time is everything, right? So it's written right behind you. So when you shut down for 8 hours, right,
Yeah.
there's going to be, I know there's a massive payoff on the back end of that. So could you talk a little bit about what practices can expect?
I'm going to try to share my screen here. Okay, so you're seeing this hypothetical scenario. Okay, yes. So basically, if you implement, this was a study done by Aldrich Consulting, okay? They're a dental consulting firm that does both practice management and accounting and things like that. And the backstory on this is they were going into practices and working with the office administrators and giving them new systems to help them work more efficiently, be able to bring in more revenue, clear up those insurance claims and so forth. And they noticed that there was just this big lack of connection between the clinic and the front office. They were seeing the dental assistants literally running down the hall, going several places to get what was needed for their procedures. And they wrote an article on what their findings were. You can go to Zirc.com and find that article under our organization tab if you're interested in doing that. But I'm going to look away from the camera here just to kind of review this. This is a ROI calculator. So what we did is we went through on the left side here, you can see the estimated cost to implement our system. We went through and took a whole bunch of scenarios of offices that we've done and averaged it out as far as, and this is including implementing the entire system, cassettes, burr holders, tubs, trays, the whole gamut. And for a one doctor, one hygiene, you can see there, it's going to cost between $2,500 and $3,200 to implement everything. So if we go over here, and pardon me for having to look the other way, if I'm going to say, all right, we took some averages, and the office overhead generally runs around 65%. So we're going to key that in here. And on average, we're seeing, at least when I was working, I know that we were trying to reach a production of about $500 an hour at minimum. And does that sound pretty close to you, Dr. Laskin, for a one doctor?
It sounds very low to me, but we're insanely productive over here. So, but yeah,
we're trying to, this is actually done very conservatively.
Frankly, I would bump it up for our audience. So maybe,
okay, let's do it.
Maybe say 750. That's
all right. 750
still sounds low, but
okay. And the cost of the product, let's just say it's going to be $3,200. And how many days are we open a week? We're going to say 4. A lot of single practices, solo practitioners tend to do that 4 work day a week. And weeks open per year, let's say 48. And now here it tells you the breakdown. So additional gross revenue on a day is going to be about $562. And the reason that is once we've implemented, and this is in that article, once you've implemented the entire system, you're going to be saving about 45 minutes per day. Now, whether you take that 45 minutes and add another procedure, and this is how they factored this, or spend the time with your patient to teach them the value so they're actually scheduling their treatment, either way, it's going to balance out to this increase in production, okay? So in the end, annually, they're going to be saving or earning an additional almost $100,000, a little over $100,000. And right here at the end, it only took 16 days to have the return on investment. And that, when I first put this together, and I didn't put this together, I'm not that smart, but when I first saw that, I was blown away that it could be really, once you have it in place and you're using it efficiently, that can be your savings and your additional revenue.
You know, and I want to kind of highlight a couple points, because when you say 45 minutes a day, I think dentists might be thinking, how can you get 45 minutes a day by doing this? Well, if you break it down, if you see 15 patients in a day, it's about 2.5 minutes. Like I think it's less than 2.5 or maybe 3 minutes per patient, yep, which you're obviously going to save doing things this way. And then, like you said, you know, the savings on equipment and materials, and you know, with the numbers you run here,
yep,
yeah, I don't think that's at all, you know, these are real numbers. And by the way, way less stress on everybody all day long. And when you bring in that assistant, that new assistant, how much quicker it is going to be to get them up and running. Absolutely. Then you're saving hours at that point. So
it's really amazing. And, you know, just to elaborate on your point, Dr. Laskin, you know, doctors that are listening, you know, does your assistant ever have to get up, leave the room to go find something that's missing during a procedure? I hear it all the time. I know it's happening, and I did it myself as an assistant, but we found the averages on that. And every time you leave the room to go find something that's missing, on average, you're wasting 3 minutes in that one time. So you can see if you're nodding back there in virtual world and saying, yep, that's a pet peeve of mine. She seems to have to be leaving every other patient or whatever it happens to be. Doctors call and they tell me, they say, I'm so tired of my assistant not having everything there that I need. If you have a good system in place, that's never going to happen. So, you know, that's just something to think about.
Or if you're a grabber like me and you don't wait for an assistant, or if you come in on the weekend and you have to set it up yourself, right? It's much better just to grab the pink tub than have to like scrounge around in the drawers and have somebody clean up all that mess that you just created, right?
Absolutely. And, you know, that's another kind of a testimonial. First thing I always ask the doctors is, tell me what's going well and tell me what your frustrations are. And I hear things like, I went in on a weekend to see an emergency patient. It took me longer to set up for the procedure than to actually do the procedure. You know, running in and opening a million drawers and trying to find what is needed without your assistant there.
I'm trying to think of the last time I came in and saw a patient without an assistant, and that wasn't the case. It always takes me longer to set up unless I've got the tub and the cassette set up for me. There's absolutely.
Yeah. You know, and I've even had assistants complain about that, especially an assistant that comes into a practice that is not organized. I've had one call and say, you know, I want to be more efficient. It feels like I'm running to 3 different rooms and opening 8 different drawers or cabinets to get everything that's needed for one procedure. We're going to consolidate all of that. Your tubs, your trays are going to be stored in a central location, okay? So you've got your tray with your cassette and all of your instrumentation, as well as your burr holders, all color-coded on this tray. You're going to have a procedure tub that's going to match this. It's going to be stored together in a central location. I call that grab and go dentistry, or grab and go organization, because you grab the tubs, the tray, you go, you've got everything that you need. You're not having to run to 3 different rooms and 8 different drawers.
Yeah, I love that. Well, thanks for sharing the ROI calculator. I think that's great. I want to sort of run all of your sort of big picture, I guess, broadly. when we're looking at organizing a practice, what does that do through our cost of implementation framework? Because we know that there is kind of a reset where you shut down your office for a day, have people come, then kind of do it. And frankly, I love the idea because we all have that drawer filled with instruments where the one half is fine and the other half is broken off, and we couldn't throw it away at the time, so we just threw it in a drawer. And
Yeah.
I mean, just clearing all that stuff out is it's like freeing up mental space, physical space, and organizational space, right?
Yes.
So I think it's a great exercise. But how does this affect kind of the pillars that we look at Upgrade? So number one, clinical quality. Can you discuss how organizing your practice, what that does from the actual quality of care that you deliver?
Yeah, kind of like what I talked about a little bit earlier, as far as the quality of care is going to be your patient perception. And the fact that we're not rushing, we can give them the good quality dentistry that they deserve, because we're not thinking about, oh my God, I'm running 20 minutes behind schedule. And, my patient's going to be upset. I still have to make that bleach tray. I don't know when I'm going to get that done. You could be focused on that patient better if you've got a good system in place. You're going to be able to teach them the value, like I said, and educate them on why this is important that they get this done and that they take care of themselves, not only their teeth or their aesthetics, but for their overall health. Obviously, we know that. Patients don't always understand that factor.
Yeah, I think you're right. When you have when you're doing a procedure and the assistant has to leave the room to go grab something, whatever you're doing, the quality drops, right? Let's say, going back to the isolation procedures, the technology that you have with Mr. Thirsty and with Instadam. Obviously, better isolation is higher quality dentistry, just flat out, period, 100%. But then organization, when the assistant leaves, they're looking at you like you're not prepared, you don't know what you're doing. And that observation by your patients going on to the O, that experience for the patient, they're feeling like you're not producing the highest quality dentistry that's available. And frankly, they're right.
As a patient, imagine what that looks like when they see the assistant, trucking down the hall. That doesn't make them calm in any case. So, we have to think about, what are we saying? How loud are we talking to each other? And how are we presenting ourselves? Are we looking like we're calm and happy and relaxed and ready to help them? Are we looking like we're frazzled and stressed out?
Well, I'm laughing about it, but it's not funny. It's true, right? because that's what's happening in offices every day, all day long.
Yeah.
And it does affect the quality of care, and it does affect the patient experience. And it does stress people out. It's not, we don't just look like we're stressed out. We are stressed out because we're disorganized.
Yeah.
And by nature, being disorganized is stressful and produces less quality. And then when, we kind of already talked about the ROI, which I love the way you broke that down. And again, that's just from the organizational side, saving about $100,000 a year. And that's huge. So,
and this was Zirc has done a lot of their own case studies too. We've got lots of them, and they all kind of come out the same, whether we're measuring it in how much added revenue or how much time did we save. We've got, all sorts of different ways that we've done that. This one was done by an unbiased, Aldrich Consulting. And so, they weren't doing this for Zirc's benefit. They were just curious how they could help their practices when they went in to do their consulting.
Well, and you're working with teams every day. And so what is the feedback on when you go into a practice for a day, reset things, then they're doing things differently tomorrow than they did yesterday? They're using tubs and cassettes and isolation techniques that they may not have used previously. What does that do for the team health, and what's the feedback that you get?
You know what? This is the favorite part of my job, because I'm a health caregiver. I go into it because I want to make people happy. I want to take care of people. And because these are my people, I feel very passionate about it. Best part of my job is doing a follow-up call after we've done a reset or after they've even implemented it themselves, because that is part of it too, if they want to save a little money that way. But I should have brought this quote in here, but I had a doctor just yesterday email me saying, well, this is amazing. This is so simple and everything is going so smoothly. And, he just went on and on. I had another doctor, and we have a video testimonial from him. He He said, before Zirc came in, we went through the office and tried to get rid of a lot of clutter and get ready for them. And we came in and we still ended up walking out of there with about 6 huge lawn bags full of junk that just had to be thrown out. And so that was kind of surprising to him. And then the other thing that this doctor said is about 2-3 months after it was implemented, his dealer rep came in and said, doctor, I just got to ask you, are you just ordering part from me now and some from a different dealer, or what's going on? Because they weren't spending near the amount of money on their materials that they usually did. And so this poor rep was thinking, what did I do? He's not ordering from me. I'm not his one and only anymore. So that was kind of an impactful statement as well.
But it was just pure waste that was going on.
Mm-hmm. Pure waste.
Wow.
And and we don't have to have all this overstock. That's not really, oh my gosh, we're going to get, if I buy one, I get 6 boxes of patient napkins. Well, where the heck are you going to put them, right? So even though you might have saved a little bit of money, it's not really saving overall, because a lot of this stuff, when we get too much, it's getting pushed out of the way. We don't have any place to put our other materials. And that's where things start expiring. All right, patient napkins don't expire, but you know what I'm trying to say.
Yeah. Well, I can't even tell you how many times we ordered something and then I'm in another part of like a storage place. I'm like, oh, we had some already. That happens all the time in dental practices because of disorganization.
You're so right. And the other thing that I recall when I was practicing even was, oh my God, we ran out of etch. Better get on the phone and order some etch today. I mean, can't work without it. And then the next day you come in and go, oh my word, we don't have any alginate. We're out of alginate. I got to get on the phone today. How wasteful is that? If you're not, you should only have to order once every other week if you've got some good systems in place,
Oh, completely.
Yep. And that's costing a lot of money. It's wasting time. You're paying extra in shipping to do it that way. So, just so many things to consider when we talk about our clinical operations and processes.
Well, great. Well, so, again, this is second opinion. So I want to ask the questions that dentists are thinking, but they can't ask, or it's easier for me to ask for them. So on the reset program, I know you're still developing the 3 programs, but you have an idea of what that costs to come in and reset a practice?
Well, right now, it usually was $2,500, and that would cover basically our travel expenses, because we send 2 people out with airfare, hotel, meals, and we'd have a little over, we'd have a little income that we would get from that. But really, it was mostly there to cover the expenses for us to travel out there. You're buying the product, and we want to make it affordable. So we still are going to start at that $2,500. But man, have you checked airfare lately? It's really gone up. I just had to get a flight to Oregon for work, and it was almost $700. So we're hoping to keep it right around that $2,500. But if we end up having this outrageous airfare, it could go up a little bit depending on what area you're in.
Well, so that is a good reason for people to jump on it and say, do it as soon as possible. I just booked a flight to LA and it was over $1,000.
No kidding.
Yep. So I hear you. Well, so where can people find out more information? Obviously, we'll have a link around this video, but if they're driving today and they want to set up a reset for their practice, they want to find out more about Zirc and your isolation products, your organizational products, your color coding system, where can they go?
Well, they can go to Zirc.com and you'll find everything there that you need. We've got several different drop-down menus with organization, and we'll have the ROI calculator, the cost of what the products might be if you implemented the whole system. You can call me direct, and if you're driving, I know you're not going to be able to write this down, but it's 763-251-3029. My name is Kay. Or you can email me at kay@zirc.com.
Well, it's ZIRC.com, right?
Yep.
Zirc. So
right. Thank you, doctor. And we have a lot of resources. We can send you out examples of what tubs could look like. We've got videos, we've got, case studies, we've got a whole plethora of resources for you. We've got an organizational checklist that we could send. You can go through your office and see what kind of a grade you get. Maybe you're doing really well in some areas and just need some help in some others. So, please visit our website, call me personally, find out what we can do to help you. That's part of the plan is, whenever you're getting the product in your office, if you're getting Zobi, for example, which is going to give you over 30 organizational products, you're also going to get one of us, one of the clinical efficiency consultants. And we will hold your hand as much as you need to. And if you don't want to use us, you don't have to. We have thick skin, but we are there to really help you get this streamlined. We do intake conversations if you want to go that far. We do full assessments of your practice to find out, maybe there's some blind spots that you're not even aware of, and that's very often the thing. We have so many blind spots because in dentistry, we've done it the same way for so long, we just might not know there's a better system. So please take advantage of that. I would love to be able to help you out.
Well, and I've got to say, every dental practice is going to need these products. Like, you need to put your instruments in something when you sterilize them. Either it's going to be some disposable bag that you use over and over again that has, sharps, risks, and problems with organization, or you're going to use something that makes sense, right? You might as well get the thing that makes sense. And the same thing is true with isolation. You're going to want to use a rubber dam, get the one that's easier to use. So I would implore our team, the people that are listening to this, to, if they haven't used Zirc products, to reach out. I know I've been out there because it's actually 20 minutes from my office where I am right now. Kay's only 20 minutes away, which is weird in dentistry to be doing this, because usually I'm talking to people all around the country,
Yes.
or the world, frankly. But I really, you guys, I've been out there. Great people doing great things, and I know that you help out practices as much as you can, and so I appreciate all you do for dentistry.
Well, thank you. We appreciate that very much.
So everybody go to zirc.com, ZIRC.com, and we'll put more information around this video. And thank you, Kay.
Thank you. Thank you, everybody, for joining. I appreciate your time.